Hello and welcome to Kim's video tour, where one comes to learn about one patient-family resource. Allow me to introduce myself. Hi, my name is Kimberly Klomovich. I am an RN currently employed in agency nursing with a specialty in psychiatric and corrections nursing. I am working towards my Master's of Science of Nursing at SUNY Upstate University with a concentration in psychiatric family mental health nurse practitioner. I am also a veteran of the U.S. Air Force, serving from 2001 to 2004, and I have a diagnosis of PTSD. The chronic condition I will be focusing on for this assignment is combat-related post-traumatic stress disorder. But why specifically combat-related PTSD? The U.S. has been engaged in 20 years of conflict in the Middle East. By 2010, Operation Enduring Freedom and Operation Iraqi Freedom were the longest sustained military operations since the Vietnam War. OEF and OIF were characterized by heavy use of National Guard members, multiple redeployments, and very long deployments. Recently, U.S. troops were withdrawn from Afghanistan, marking the end of the conflict in the Middle East. The decision to withdraw troops from Afghanistan was announced in November 17th of 2020, and the military withdrawal was complete on August 30th, 2021. Over those 20 years, millions of troops, over millions of deployments, were sent to a war zone. The website we'll be touring today is the National Center for PTSD. The National Center for PTSD was created in 1989 within the Department of Veterans Affairs, also known as the VA. The center's mission is to advance the clinical care and social welfare of veterans and others who have experienced trauma. The National Center for PTSD does not provide patient care. Under the Source Educational Evaluation rubric, the National Center for PTSD's website would score a 3.8 to a 4. It's a highly respected site that has thousands of backlinks from U.S. and international government and nonprofit agencies, including the National Institutes for Mental Health, the National Center on Domestic and Sexual Violence, the American Medical Association, and the Royal College of Psychiatrists. As an educational resource, the National Center for PTSD's website contains plain language information for patients and their families, the website also connects to databases and repositories for research scientists, and finally, it connects to evidence-based clinical tools and continuing medical education for clinicians. One of the things I like most about the National Center for PTSD's website is that it allows people to explore the topic of PTSD, explore whether or not they feel like it applies to them, and then also explore what their options would be as far as treatment if they did have PTSD, without having to engage with a clinician and feel either judged or misunderstood. For example, one of the sections under the Understand PTSD section of the website is called Is It PTSD?, which has another part that's called Do I Have PTSD? And basically, although it does encourage veterans to seek out a professional or someone else to talk to about their symptoms, it also gives the primary care screener for PTSD. And basically all this is here is, have you had a traumatic event? Have you had these symptoms for the last month? And what we're talking about here is basically the DSM-5 criteria. So we're just giving the DSM-5 criteria to these veterans and seeing if that applies to them at all. When discussing the effects of PTSD on friends and family, the National Center for PTSD also has extensive resources. One of my favorite things here is actually discussing when a child's parent has PTSD. Having a parent with PTSD can significantly impact children, and because of the way that the symptoms present, they can also be very unpredictable, which can cause things like secondary traumatization, especially if there's violence. Children of veterans with PTSD can have social problems, behavioral problems, emotional problems, and then you can actually see like generational PTSD. One of the treatment options explained under the children affected by PTSD portion of the website is that it does normalize family therapy, and that family therapy supports the parent, it supports the family, and it supports the children, so that all people are getting their needs met, and that the family unit can become more cohesive and better functioning. Under the Providers tab on the National Center for PTSD's website, they have assessment tools that include adult interviews, including PTSD scales from the DSM-5. They have a lot of self-reporting scales that a clinician could use in practice. They have pre- and post-deployment scales and discuss extensively what contributes to PTSD in relation to deployments. And then finally, we're back to things like the primary care PTSD screener. There's also some pretty extensive continuing medical education offerings for clinicians so that they could become better equipped for understanding and or treating PTSD. For this section, we're going to discuss the tool on the National Center for PTSD's website called the PTSD Treatment Decision Aid. This is an online tool that leads people through a process, non-clinicians through a process of learning about PTSD, seeing if they identify with those symptoms, and then discussing the different treatment modalities for PTSD, comparing those modalities, and then helping the veteran build a plan to start treatment. The one thing that I like about this tool is that each section is more interactive than the website. So I feel that that might be more engaging. So for patients, having this sort of little Venn diagrams showing, what are the different treatment options for PTSD, what they mean. Oftentimes, once you're starting to get into these options, it gets very clinically focused. And sometimes that clinically heavy language can be intimidating for someone who's new to treatment. The next option lets the veteran decide what it is that they want in treatment. What would they feel comfortable engaging with? Do they want to take medications? Are they not sure about what they would want? And this sort of helps the tool narrow down treatment options for the veteran so that they can better advocate for themselves. As the questions go on, there's only about 6 of them, but there are some options where there are videos that explain the differences between some of the options, like individual versus group therapy. And then after that, the next step is deciding which sort of treatment the veteran would prefer. And so that gives really good tools like a comparison chart. So not only for the comparison chart of the treatments that the tool recommends based on the veteran's input, but the veteran can also choose to see the other treatment options and rule out everything if that's what they want to do. Final part of the tool helps the veteran build a plan for having a conversation with their provider and getting the help they need. It helps them by deciding which treatment they would prefer to talk about. It also provides videos about what one can expect when discussing treatment with their provider. And finally, it allows the veteran to print out their results from this self-assessment tool and self-planning tool so that they are prepared and able to advocate for themselves when they meet with their provider. Thank you so much for watching my video. Today we visited the website for the National Center for PTSD, which has extensive resources for patients, families, clinicians, and scientists. If you would like to know more about it, you can visit ptsd.va.gov.